Hello, my name is Marianne, student physical therapy assistant.
And I'm Howard, student physical therapist assistant.
So this is good. We're going to be talking to you guys about what you will be seeing in the program. So I know that you guys still will be entering the physical therapy program. So this is just a small aspect of many things that you'll be seeing with nerve tensions. So before we start, how many people here ride bikes?
Okay. 3, 4, okay.
Okay. And then how many people like to write a lot, like lots of writing? Okay, nobody likes to write. All right, so basically, all of this is different things that will cause your ulnar nerve entrapment, all right? So I'll go ahead and start explaining on where you'll see it, where it passes through. So your ulnar nerve passes posterior, meaning if you guys don't know what posterior is, it's in the back of the elbow and in the groove between the medial epicondyle, which you guys will be learning once you enter the program. And ulnar nerve emerges from the medial cord of the brachial plexus to the lower border of the pec major. So in a really short, condensed way, it just flows right down your forearm. I do know of people that have it and it's very, very painful. You will feel a tingling sensation. Later on, we'll show you guys how to be able to test it. You'll learn it in the program, but it is a very painful thing if you don't get it treated. And it's very easy to get it treated, actually. All you have to do is stop doing what you're doing all the time, basically. With writing, with using your wrist. All right, so etiology is, once we said prolonged handwriting, leaning forward on your wrists, any gripping. So we do have different types of grips that I'll talk to you guys about, which basically any gripping of, so if you're holding a bike, these kind of grips, gripping your pen. So one of the biggest things is falling on the ulnar border of your wrist, which your ulna is going to be right here. You guys, for so sorry guys, who knows where your ulna is?
Few of you? Good.
Okay, good. So you will learn about this, and then if you look up here, we have all the bones that do correlate around this. So you have, let's see here. I'm so sorry. So you have your hamate and pisiform. All right, so these two bones are basically between the hook. Those two are the ones that you'll see that are the most effective. All right, so positive finding sensations. Howard, do you mind showing just Tinel sign, just so they can get an idea?
What you'll have them do is have them, the patient, have them straighten their arm out, and you just tap right where the nerve will run through. And if they have any tingling sensation or numbness, it'll be a positive sign.
Yeah. So there's different tests for nerves that you guys will be learning. This is one of them for this kind of ulnar. So we have sensory symptoms, which will fall right on the little finger, your pinky. One of the things that is the most active with enhancing this is opening jars, turning doorknobs, and you'll figure out if you really have it. Positive clinical findings is atrophy of the hypothenar eminence. So hypothenar eminence, so if you guys just all want to look, it's right here. So if you just want to kind of palpate on your own hands. And these intrinsic muscles will start feeling atrophy and start feeling the tingling sensation.
Okay, so now we can talk about the grips that you were talking about earlier. So we have the spherical grip, more like this, or like the pencil when you write your pencil or pen. We have a hook grip. We have a cylindrical grip, so it's more like if you're holding like a bar or anything like, so like when you're working out maybe. And then we have the lateral grip, which is just doing like this as well. And these all these are power grips. Let's see. So with the entrapment of the nerve, you will have fatigue in the hand. You also you have an inability to use your fourth and fifth digits. So these two fingers here with certain grips as well. And then performance usually is when it starts to hurt, and then when you're resting or not doing anything, that's when it goes away. So, like I said, to manage the pain, you rest or stop doing activity doing that provokes the pain, and then
It's okay, guys.
it threw me off. Okay, so to mobilize the nerve, what we do is moving the wrist into extension. So this is neutral, this is extension, and then you're going to radial deviate. So radial deviate is going towards the thumb, and then you apply an overpressure stretch into extension of the little finger, so your pinky finger. So that will be mobilizing the nerve. It's also a test you'll learn later that will either show that they have the patho of the nerve entrapment or not. And then patients' symptoms that they don't improve between 6 to 12 weeks of treatment or progressive paralysis, they would need surgical repair of the nerve.
Alright, so I do want to know a raise of hands if you guys are interested. We can show you guys on each other, whoever would like to do the Tinel sign, and see if you guys might have it. Also, something else to add is that there are different types of things that we do that we can figure out on, okay, is it ulnar or radial, which he was explaining the radial deviation. And that's just really interesting stuff that we'll be learning later on. Like in this program, we've learned so much that has accumulated all together, and it's actually really interesting because I probably have this ulnar nerve entrapment for sure. So I do have a small video to show everybody. Oh, welcome. This is just somebody that shows you. Oops, so sorry. I'll just pull up the link. The link is not working, so I'll just pull it up. Are you guys excited to start the program?
Mm-hmm.
You should be. Oh.
This right there, yeah. Some people trying to plug.
Educational purposes only. Please consult your doctor before you make any decision about your medical care.
Oh, that's all.
That's the end. I'm sorry.
Oh. Well, what I can do is I'll definitely be at, I know that you guys do have a link on your handout that I gave you earlier that has this video, so we'll go ahead and you can see it, and hopefully you won't have technical problems like this. But the link is added, and also there's a resource for you guys at Johns Hopkins Medicine if you look at your handout as well. Just to, if you want more information on ulnar nerve. Is there anything else?
No, I think we missed one of the things that you also can, if provoke the pain, would be sitting like this a lot as well, or just you desk like this a lot. So
Yeah, you guys will really, just for good luck with the program, and you guys will really, sorry, I just saw someone make a face. You guys will really enjoy this program. Right? Thank you.
Thank you.